Welcome to the podcast. My name is Dr. Noor Gajraj. Let's talk about glucagon-like peptide-1 receptor agonists and kidney protection. This presentation is based on a recent paper, Glucagon-like peptide-1 receptor agonists and its possible nephroprotective role, a systemic review. This paper is by Alejandro Perensin at the University of Padua in Italy. Introduction. What are GLP-1 agonists? They're a class of drugs that mimic the hormone glucagon-like peptide-1. They are primarily used to manage type 2 diabetes. They activate GLP-1 receptors in the pancreas, gut, and brain. This leads to increased insulin secretion and suppressed glucagon release, which lowers blood sugar. They also slow gastric emptying and promote satiety, leading to weight loss. Beyond blood sugar, known benefits include improved glycemic control and weight loss. They have also shown significant cardiovascular benefits. A growing body of research suggests a potential for nephroprotection or kidney protection. The problem, diabetes and kidney disease. Diabetes is a leading cause of chronic kidney disease. High blood sugar and associated factors like high blood pressure and inflammation can damage the kidneys over time. The progression of chronic kidney disease is measured by two key markers: estimated glomerular filtration rate, a measure of how well the kidneys are filtering waste from the blood. A decline in estimated glomerular filtration rate indicates worsening kidney function. Next, albumin to creatinine ratio measures the amount of albumin, a type of protein, in the urine. High levels of albumin, proteinuria, signal kidney damage. While some studies have looked at these markers, a comprehensive review of the specific nephroprotective effects of GLP-1 agonists was needed. Study methodology. Objective: to systematically review existing evidence on the potential kidney protective effects of GLP-1 agonists in type 2 diabetes. Evidence acquisition. A systematic search was conducted across major databases. The inclusion criteria: articles on adults with type 2 diabetes, participants aged 18 or older. Study selection. Out of 783 initial studies, 13 were selected for the final review. The included studies consisted of retrospective studies, observational studies, randomized controlled trials, and one post hoc analysis. Key findings: ACR and GRF, albumin to creatinine ratio, mixed results. The findings on ACR were heterogeneous. Some studies, like Al-Gharni et al. In 2024, found a statistically significant drop in ACR after 12 months. Other studies, such as Maima et al., found no significant changes. Variable response. Garcia de Lucas showed that ACR improvements were most pronounced in patients with higher baseline CKD risk. For very high risk patients, ACR dropped from 158.5 milligrams per gram to 55 milligrams per gram. Estimated glomerular filtration rate. Stabilization or slower decline. Overall, GLP-1 agonists appear to help slow down the decline in glomerular filtration rate. Mima et al. Reported an average improvement in glomerular filtration rate from 1.2 to 0.7 milliliters per minute per square meter. However, some studies, like Algarni et al., noted a slight glomerular filtration rate decline, albeit a modest one. Delta GFR, the calculated delta GFR change over time, varied across studies, reflecting differences in patient populations and study designs. For example, Alviles Bueno et al. In 2022 noted a positive shift with a delta GFR of plus 2.2. Additional benefits, glycemic control and beyond, glycolated hemoglobin. All included studies showed significant reductions in HbA1c levels. Algarni et al. Reported a drop from 9.18% to 8.13%. Garcia de Lucas et al. Saw a decrease from 8.3 to 6.59 in lower risk patients. Weight and blood pressure. GLP-1 agonists are known to promote weight loss and lower blood pressure, both of which reduce stress on the kidneys. This is an important additional layer of nephroprotection. Proposed mechanisms of nephroprotection, anti-inflammatory effects. GLP-1 agonists such as semaglutide and tirzepatide help reduce chronic low-grade inflammation, a key driver of kidney damage. They lower pro-inflammatory molecules like tumor necrosis factor A and interleukin 6. Anti-fibrotic effects. They combat kidney fibrosis or scarring, which is a major factor in chronic kidney disease progression. They reduce the activity of tumor growth factor beta, a key driver of fibrotic processes. Improved vascular function. By improving blood pressure, these drugs ease the pressure on the kidneys, delicate filtering units or glomeruli, which helps protect them from damage and reduces protein leakage. Implications and limitations. Clinical implications. GLP-1 agonists are a promising treatment option for managing both type 2 diabetes and chronic kidney disease. The findings support their use as part of a comprehensive care strategy, especially in high-risk patients. Considerations for geriatric patients. Data on frail older adults over 75 is limiting, representing a key research gap. Careful monitoring is essential due to polypharmacy and other health issues in this population. The limitations of this study. Variability. Studies differed in design, duration, sample size, and patient characteristics. Inconsistency. The methods used to measure renal function were not always consistent. Bias. Some studies had a potential for bias due to industry funding or lack of consistent blinding. Short-term data. Most studies provided only short to medium-term outcomes. Conclusion and future directions. This systematic review confirms the potential of GLP-1 agonists, particularly semaglutide, to provide nephroprotection in type 2 diabetes patients. These drugs offer dual benefits by controlling blood glucose and stabilizing or improving key kidney markers, such as GFR and ACR. Future research needs. Conduct larger, more standardized and long-term trials. Include a more diverse range of participants to ensure the findings are broadly applicable. Explore the effects of combining GLP-1 agonists with other nephroprotective agents like SGLT2 inhibitors, and investigate the impact of GLP-1 agonists on patients' quality of life. Thank you for listening. Please consider buying my book, 100 Pathways to Longevity, and subscribing to this channel. Thank you.